Hi and welcome back. I recently made a video in which I talk about the differences between cosmetic needling and medical microneedling. In that video, I also show you in detail how I personally cosmetic needle. If you have not seen that video, I will link it right up here and also down below this video. Now, in that video, I said that I didn't want to be repetitive and make a separate video on medical microneedling. However, many of you asked me to do so regardless. So right now, my beautiful friend Tamara from Tamara's Timeless Beauty is here to visit me in Paris. We have been having so much fun exploring the city together and just having girl time. Tamara is fairly new to microneedling, so I thought it would be a good idea to medical microneedle together, sort of beginner versus advanced. And hopefully that will be helpful to you. All right, so our faces are completely clean. We both double cleansed our faces and necks. Our hands are clean. We do have some alcohol pads just in case, and we have all of our equipment. So Tamara is fairly new to microneedling. You have microneedled how many times?
3. You showed me on a Zoom call, I think about a year ago, with the roller, but I've never used a pen, a doctor pen.
Okay, so 3 times, so pretty new. So what we're going to do is we are both going to medical microneedle, but Tamara is just going to go at 0.5, and I'm going to go a little bit deeper. I'll go at 1 millimeter, especially right here where I'm sunken in, because it is a bit harder to get to where I want to get. And on my forehead, I will go 0.5, and around the eyes, we will both go less deep. And we'll just do it and see what happens. So Tamara is going to use the Dr. Pen M8, and I'm going to use the A6S. These are both fantastic. They're basically the same. I just prefer this color. And we both have 16 pin cartridges. So for medical microneedling, we use a 16 pin cartridge. Where we do cosmetic needle, we would use a 36 pin cartridge. But since we want deeper penetration, we're going to use a 16 pin cartridge.
So the lower number of needles, the deeper the penetration.
Exactly.
Okay.
So think about if there's one nail in the ground and you step on it,
Ouch.
that nail is going to go right in your foot. But if there's a bed of nails, it'll hurt a little bit, but they won't penetrate.
Okay, good example.
So the less needles, the deeper the penetration.
Okay.
Now, we are both going to do the stamping technique, which is something I have adapted, and I think it's my preferred technique at this point. I find that it is the safest and also the most effective. I do feel that I get better results from it. So because we're both stamping, we don't have to have anything on our face. Where we do tiny little circles, we would use some high molecular weight hyaluronic acid, or I also have some stem factor serum right here, so some growth factor serum. This is okay to be used with medical microneedling. So is the Calecim professional serum. Neither of these, however, give a lot of slip. So was I to do, or Tamara, tiny little circles, this is what we would be using.
So it glides.
To glide, because you don't just, the cartridge has some plastic right here, and the needles kind of jut in and out. But when the needles, well, when they're in or out, you don't just want to scrape them over your skin and create scratches. So that's why when you do circles, high molecular weight, hyaluronic acid, high molecular weight because it's anti-inflammatory. But again, because we are stamping, we don't need anything for glide. So let's put our pens together.
Okay.
So these come individually wrapped, and I always use a fresh cartridge for every time. These are fairly inexpensive. It's not a lot of waste.
Put my glasses.
So these are fairly inexpensive. It's not a lot of waste. But using a fresh cartridge, you're sure that it is sterile and that the needles are nice and sharp. So I would say always use a fresh cartridge.
I already need help. I can't.
No problem. So all you do is you take this, put it in, and then it clicks in. And there's a little plastic protection we'll take off later. So you open it up. Okay. And then you put it in, and you just the other way around.
What do you mean the other way around?
This way around. That's okay. So Tamara has never even looked at the Dr. Pen.
Correct.
So that's good. You're a great example for everybody else to learn. And you really want to make sure that it's clicks in tight. So the A6S has the numbers right here, and yours does too.
Okay.
Yours is very, very tiny, so I'm going to dial it in for you. The M8, the numbers are ridiculously tiny, even with glasses on. So right now it's on 0.2. So we're going to put it at 0.5. So 0.5 or deeper is considered medical microneedling.
Okay, I see it. Yeah, okay.
See it? Mm-hmm. And I'm going to put mine on 1. So I've dialed it in to 1 millimeter. And are you ready to go?
Yes.
So again, our faces are completely clean. That is very important when medical microneedling. We are not using numbing cream because you have a okay pain tolerance, right?
Mm-hmm.
And 0.5 millimeters is really not that painful.
Yeah.
Even 1 millimeter is not that painful. Not that painful. Were we to use numbing cream, we really need to make sure to wash it off well, because you don't want to needle the numbing cream into the skin. Mm-hmm. So our faces are completely clean, our hands are clean, our neck is clean. So let's get started. So we're going to take the plastic protection off. Now, some of you have asked me what speed to use for stamping. I honestly don't know what's the best speed to use for that. I always put it on a medium speed, so like a 4 or 5.
So the number here is a speed.
Exactly.
And
so there is a little window that has numbers on the M8 as well. And so I have it on a 4 right now. So I would say put it on a 4 or 5. So put it on
2,
a
3,
there you go.
4.
Okay. So I like to personally start at my jawline. And I sort of section my face. So this is one section, this is another one. My chin and around the mouth is another one, and then my forehead is another one. Personally, I don't microneedle my nose. There is nothing wrong with microneedling the nose. I just always break out, so I give up on it. But I like to start at my jawline, go vertically all the way up till I get to the orbital bone.
Moving it a little at a
Exactly,
time.
moving it a little at a time. So you think about, I'm going to show you on my hand. So if I stamp right here, right, I'm going to just stamp it for a second, lift it, stamp it right next to it. So I want to make sure I cover the whole area, but I don't want to overlap too much.
Too much, okay.
We're going to overlap some because we're going to go vertical, or horizontal, not vertical, horizontal and then vertically.
Okay.
So both of us have a mirror next to us, or Tamara has one right in front of her. So if we're not looking at you, sorry, we're looking in the mirror, making sure we're not poking our eyes out. So start with me at the jawline. So just down from the mouth at the jawline, little prick, boom.
Just, and like just a touch.
I'm gonna watch you for a second.
Okay, I did that. Just like
so
that?
A little longer.
A little more?
Let me do it for you for just a second. You want to make sure the needles actually penetrate, right? So stamp. You okay?
Yeah.
Is that painful?
It's a little more than I expected.
Is it?
Uh-huh.
I have to admit, stamping is a bit more intense than doing circles. I'm not sure why that is. But that I also think because of that I get a more effective treatment, and I get a cleaner treatment because I get clean puncture wounds. But it is a little bit more intense. And you also haven't done it in a long time, so you probably don't remember. Because using a roller...
When I was rolling, it never felt like that.
I find using a roller more intense.
I probably wasn't pushing hard enough.
The first few you don't know what to expect. As you get going, your body gets used to it. Let's try it.
Okay.
If we have to dial it down, we'll dial it down.
Okay.
So we're going to do it together. Just quick second. Little longer.
I'm a baby.
You're going through all of this, you might as well get something out of it.
Right.
So, just for like a 21.
Okay.
21. 1 second contact. There you go. That was a good one. That's
21. I'm saying 21 in my head.
Good.
Okay. Once you get used to it, it's not that bad.
Exactly.
I don't want to scare anybody.
No, it's true. Once you get used to it. I mean, I am going at 1 millimeter. You feel it. You feel the needles go in. But the first few, you're like, oh, that's weird. And then it's not that bad.
Exactly.
So we'll go all the way to the ear. There you go. Good. And then I like to just make my way back down.
Okay.
So I'm going to just...
Above it.
Exactly. So not really overlapping much, but just like going right above it, going back down, and then just go sort of back and forth.
Like mowing the lawn.
Exactly. How are you doing? You good?
Yeah,
Yeah?
it's really not that bad. I know I acted all scared, but it's not bad.
Now, Tamara, so about a year ago, I showed you how to use the roller and then you stopped. Why did you stop?
I was always worried about trying to plan for the downtime, and I really wasn't 100% sure I was doing it right, getting the right intensity, which I probably wasn't. This helps because it sort of does the intensity for you.
Yeah, and you don't have to apply a lot of pressure, so you don't have to like, go crazy. You just place it on the skin and then the needles jut in.
Okay, so I came down, just keep going back and forth.
Just keep going back and forth.
And we're starting on the corner of the mouth?
Yeah, that's how I do it. You can do it differently.
Okay.
That's how I do it, but you can do it differently. I just like to sort of section it off to make, that's just how I've done it forever, so I'm used to it. But you can do it differently if you want to. So Tamara is right, there is definitely some downtime with medical microneedling. With cosmetic needling, you will have some erythema, some redness for a couple of hours if you have sensitive skin like I. If you don't, you probably won't even have that for a couple of hours. With medical microneedling, there definitely is some downtime. So depending on the depth you go, so Tamara is going 0.5 a day at the most, I would say. Tomorrow you'll be a tiny bit pink, but nothing she couldn't just cover up with some tinted mineral sunscreen.
So the people at Monet's garden aren't going to be scared of me.
They won't be scared of you. Tamara is going to Monet's garden tomorrow in Paris.
So excited.
Unfortunately, I can't come because I can't bring Serum and it's a whole day trip.
Yeah.
But so she will have a little bit of downtime, but with a tinted mineral sunscreen, easy to cover up. I will have a little bit more downtime because I'm going a little bit deeper, about 2 days of downtime. But again, nothing I couldn't cover up with a bit of mineral sunscreen. But if you have an event, I would say definitely don't do it the day before. There definitely is a bit of downtime.
I think I'm not making the rows close enough together, maybe.
Okay. So try getting them a little closer. So you will see where you are. So you can see the erythema I'm creating.
Yeah, like I have a white line in between.
So try to touch your face as little as possible.
Yeah.
Yeah, you do have a bit of a white line, and sometimes it's also difficult for me where I'm sunken in. That white line will happen. That is why I go a bit deeper.
Okay.
So sometimes I have to take my tongue and work this, or have to sort of puff my skin out. So yeah, you want to create some even erythema because you don't want to go through all of this, create downtime, and then miss half of your face. That would be a bummer. Now, of course, the reason we're doing this is to create more collagen. So we are creating a controlled injury right now. We are creating a bit of damage to the skin. And I always think about it like working out, right? If I lift weights, if I do a bicep curl, I lift heavy enough so that I create a bit of damage in my muscle. That damage then the body repairs and the muscle goes back stronger. If I don't lift heavy enough to create that damage, my muscle isn't going to get stronger. So we are creating a bit of damage right now, but the body is going to heal that. It's going through a cascade of reactions. Eventually, it leads to more collagen and elastin production. So that's why we're doing this.
And cosmetic needling is more for absorption of serums, or?
Exactly. Cosmetic needling, so cosmetic needling, you go 0.2 to 0.3 millimeters. So you're just entering into the epidermis. You go through the stratum corneum into the epidermis. Collagen and elastin fibers are in the dermis. Some people say cosmetic needling also helps with collagen production. Personally, I think it's more of a product penetration benefit, but a great benefit as well. So I'm getting just a tiny bit of pinpoint bleeding. That's completely normal, especially where I'm a bit more bony. And Tamara doesn't have any. And pinpoint bleeding is normal, but it is not necessary to get good results. Okay. Some people think if they're not bleeding, they're not going deep enough. Pinpoint bleeding is not necessary. But if it happens, I sometimes even pinpoint bleed with cosmetic needling because I have very thin skin. So nothing to be concerned about,
so
but not necessary.
Do I do another pass?
You can do one more pass. So we want to go not past the orbital bone, but you can go to the orbital bone.
Okay.
We are going to go under the eye, but we are going to do that separately. Tamara has some nice even erythema. So now we're going down vertically. Exactly.
Okay, and where do we start?
I like to start right here. It really doesn't matter.
Right.
It's just
keep track of where you've been.
It doesn't matter where you start. And you don't, some people like to section even just little squares. However it works. This is just what I have done and what works for me. But find what works for you. Oh, you're getting brave. So go a little bit closer to the ear. You know how we get those lines as we age by the ear? And we all hate them. So this is a good way to sort of, so what you can do is, pull your ear a little bit.
Okay.
Pull a little taut. And then go on to those lines. And that will help.
Yes.
Good? So if you have a lot of loose skin, sort of pulling on the ear a little bit, or with clean hands, pulling on the skin a little bit, can be helpful. But with the stamping technique, I feel I don't need that as much as I used to need it with doing tiny little circles. Look at you getting brave.
Missed a line there.
And now it's not so painful, right?
Right.
Yeah.
No, it's like nothing. I was just surprised.
Yeah. Of course, if the neighbors look in here, they're like, what are these two crazy ladies doing?
Well, we're not going anywhere tonight, that's for sure.
Nope, we're not going anywhere. So I like to medical microneedle in the evenings, just so that I don't have to apply anything, because afterwards I want to be very careful what I apply, because I am creating open channels. They close up fairly quickly, but I have seen some studies saying that they can stay open up to 18 hours or even longer depending on the depth. So I like to do it in the evening. Then I don't have to worry about applying sunscreen or anything else. I just apply my medical microneedling approved products and I go to bed. So you prefer this over the roller?
Definitely.
Yeah? Now you could just use a stamp, obviously, since we're just doing a stamping technique. And I actually just got a Dr. Pen stamp where you can adjust the depth.
I knew.
So because normally if you have a stamp, let's say you have a 0.2 millimeter stamp, that's the length you're stuck with. But this one that I got, actually, I'll show it in a different video. You can adjust it just like this. I use it for cosmetic needling sometimes, but for medical microneedling, I still prefer this. I feel it's just more precise. I also don't have to worry about sanitizing it. I just throw this out afterwards. Right. I don't have to worry.
That was,
So again, we both have a mirror. So I'm sorry if we're not looking at you.
Yeah, and it's a little more sensitive on the jawline where I started. It's interesting. So different areas of your face have different sensitivities.
So because of bone right there, and then also where the skin is thin, like around the lips, that's a bit more sensitive. So yeah, you're right. For me, the jawline isn't so bad, but my cheekbones are a bit more sensitive because they're just very bony.
I definitely want to get those jowls, you know.
Somebody asked me, is microneedling good for jowls? Honestly, not really. Jowls is excess skin, right? It's gravity taking over. Some of it is bone loss, some of it is gravity, some of it is collagen loss. So this does help with collagen production and therefore can maybe help a tiny bit, but it's not going to eliminate jowls, unfortunately. I wouldn't have any otherwise because I do this quite frequently. What it has done for me, it has really thickened my skin. I used to have extremely thin skin. When I would get extractions, my friend is an esthetician, and when she would give me extractions, my skin would come off. That's how thin my skin was. And this has really thickened my skin because of that extra collagen production. But as far as loose skin, it can't do much. Not to the point where you're like, wow, this is really amazing. You might see a tiny bit of a difference.
Well, every little bit helps.
Exactly. But I think as far as jowls, maybe microcurrent is a bit more efficient.
Lifting. Okay.
The oral lift even.
Oh yeah.
Maybe heat devices to shrink, because some of it is also fat pocket sliding down. Microneedling won't do much for that, but it will do wonders for your skin. Look at Tamara, she's like a pro now. Good job. Looks like you're enjoying it now. By the way, for those of you who don't know Tamara already, I think most of you do, but Tamara has a YouTube channel as well, which I will link down below. And Tamara and I met through YouTube. We started commenting on each other's videos, and at some point we said, let's do a FaceTime call. That was about 3 years ago. And we started talking about every week.
Yeah.
And then Tamara was supposed to come visit me last year already.
I had my tickets and everything.
And then we had to leave our apartment because of flooding.
Right.
So Tamara is here to visit right now. And Tamara did a video where she did my makeup. So if you ever wonder what I look like with makeup, I will link that video down below.
Just a little bit of playtime.
It was fun. And
yeah.
we've seen a lot
I felt
of...
a little weird putting makeup on Claudia because she's so amazingly beautiful without it, but it was
especially
fun.
right now.
Yeah, right.
Look at Tamara. She's just like totally in trance. She's gonna do this every night now. No, you only want to medical microneedle about every 4
I hit a spot
to
that
6
makes me
weeks.
want to sneeze.
Yes, around the nose. Yeah. So around the nose or right here, you might want to sneeze.
I think it passed.
It's
My
okay.
eyes are watering from the sneeze. You know.
That's totally normal. But yeah, medical microneedling, we do not want to do more frequently than every 4 to 6 weeks, because it does take time for this controlled injury to heal. And it does take time for the body to finish a full collagen cycle. And we don't want to interrupt that. So see, you went from, I'm afraid, this hurts, to just like...
All in one sitting. I have a great teacher.
So
I'm glad to do this with you for the first time. It does help because I'm kind of, oh.
Yeah, it is a little, I mean, you're thinking you're poking needles into your skin. It is a little bit intimidating. And
Yeah.
But it really is not, if you do everything cleanly and correctly. And
Now, do you also cosmetic needle in between?
so I medical microneedle ideally every 4 weeks. Sometimes that doesn't happen because an event will come up or something. I always write it in my schedule so that I remember when the last time was. Then I don't cosmetic needle till the following week. So if I happen to make medical microneedle on a Friday, cosmetic needle the following Friday. I do that for 3 weeks, following Friday.
Okay.
And then the 4th week or 5th or 6th, I medical microneedle again.
Okay.
Yeah. So you definitely, yes, you can cosmetic needle in between medical microneedling.
Okay.
Now there's also nanoneedling. And nanoneedling, as confusing as it is because it is called nanoneedling, it actually doesn't use needles. So while we have tiny little needles in here, nanoneedling, these cartridges just have these little cones and they don't pierce the stratum corneum. What they do is they just slightly separate the cells of the stratum corneum so product can slip in there. So nanoneedling is strictly for product penetration. Good job.
Okay, now what? I'm ready.
So let's do, so the forehead and around the lips are somewhat equal because there is not much here, just skin and bone. So you choose. What
Forehead.
Okay, so we'll do the forehead.
I know my lips are going to be really sensitive.
So I like to, I'm actually going to go a little bit less deep on the forehead. I'm going to put my glasses on and go 0.5 on my forehead.
Okay.
So I actually like to go over my eyebrows.
Okay. On the actual eyebrows. Okay.
Because we know that, you know, on the scalp it can help with hair growth, so it can also help with hair growth there. Now, they're a little bit sensitive. I was going to warn you. It's definitely a bit more sensitive.
Yeah.
And your eyes might start tearing.
Yeah.
The eyebrows are really sensitive for some reason.
Oh.
Don't scare people.
No.
It's not that bad.
No, it's not that bad. It's doable.
It is sensitive.
It's doable.
You were doing really awesome. I am sort of speeding through my eyebrows because they are
No,
very sensitive.
I did it once inside. Now I'm doing it on top.
Good. And then we just do the same thing. We start and we go horizontally.
Are you going all the way across or half? Halfway.
I'm going all the way. I have to sneeze. I'm going all the way across. Oh, yeah, I'm going all the way across. But
this is fun.
oh, I thought we had some tissues here. I'm going all the way across, but you can go. Do what works for you.
Half.
Yeah, you can section your face however you want.
Yeah.
Like I said, some people just do small little squares. So this definitely will make your nose run on your forehead. We are not crying. It's just a reflex. And you might get a bit more pinpoint fading on your forehead, again, because there's just really nothing there aside from skin and bone. You good? All right. Now, we're going to go the chin and around the lips.
Okay.
So let's start with the chin. So you can color away faces, you know, because I have sort of a dent in the chin. Well, making faces helps me. And again, I'm going to go vertically and then horizontally. Okay? Starting where I ended before, so I can see where I have the redness. So I don't want to go over that redness again, but I'm going right here where there is no redness. And then go all the way across.
Okay.
And then work my way back up. How does it feel on the chin?
Well, you know, it's a little sensitive. Not Not too bad.
But would you call any of this pain?
No.
No. Discomfort at the most?
Well, yes, at the
Yeah.
most. No, for the upper lip.
You had. Don't think about it. So for the upper lip, try to make a little bit of it and just do it. It is the only bit sensitive, the upper lip. You can do it.
I can do it.
Ready?
Because I want to get rid of
Those lip
soften
lines?
those lip lines.
Exactly.
I know it won't get rid of them, but
It'll soften them.
Okay, if I jump, just don't worry, I'll power through it.
So don't knock the camera over. You're doing great.
Good, yeah.
Good.
Eyes are watering.
Now
a
see,
little
you
bit.
have a tiny bit of pimple bleeding on the chin now too, even though you're not going that deep, but it's just because the skin is thinner there and there's some bone there. So totally normal.
Look at my tear.
I'm not going to lie, this is not like the Thai massage we had earlier.
I'm glad we, no, we have to do vertical above the lip.
So because that is a small area, it is tough to go vertically and horizontally.
Yeah.
So I just kind of go like
Yeah.
that. Making sure I'm not over treating, but that I'm treating it enough. Because I do want to get rid of those or soften those smoker lines, even though I've never smoked. So now we're going to both dial our pen down to 0.25. And we're going to take some alcohol swabs. So because we're going to touch our face now, you know, our hands are obviously clean because we washed them, but we have touched the pen and everything. So just to be on the complete safe side, we are going to wipe our hands down because we have those open channels now, right? We don't want to have a smidge of bacteria and then introduce that into the skin. So what I like to do is I like to take my mirror, take 2 fingers, place them in the corner of the eye and then on the outside, hold that down just slightly, really gently, and also keep it taut with those fingers. And I can get a bit closer to the lash line. And that just allows us to get a little closer to the lash line. And obviously it's such a small area that it's hard to go vertically. So I just go horizontally a few times. And you definitely want to look in the mirror for that one. And then once you have that, you can do your crow's feet. You can also go, so you don't want to go on the eyelid itself, but you can go, you know, on the brow bone if you want to, which is a little sensitive.
It's very interesting, the different areas of the face, you know?
But here I always just go 0.25 because
Yeah.
the skin is so thin. I definitely don't want to go 1 millimeter.
Right.
You can do the same thing on the other side. That's the whole face.
Okay.
So now we're going to do the neck.
Okay.
And strangely enough, even though the skin on the neck is quite sensitive, I don't find the neck painful at all.
Okay, good.
So I'm actually going back to 1 millimeter on the neck, and I would say you can go to 0.5. So I like to section my neck like you did your forehead, kind of in the middle, to one
Quadrants.
side. Exactly. So again, I do the same thing. I go horizontally and then vertically. Now some people say to avoid the thyroid. We're not going very deep. It's not like we're actually going to poke into the thyroid. But I would say if you had any thyroid disease or any concerns, I wouldn't be.
Just skip it.
I would say to skip the thyroid.
Yeah.
So it's up to you if you want to do the thyroid or not. But I have, because I had neck surgery, I have a scar right here on my thyroid. So I like to soften that a bit because it does look like a wrinkle. So I like to start
Just above your clavicle.
just above the clavicle, and same thing. I just go all the way, and then I work my way back up. Now you could do the back of the neck if you wanted to. I'm not quite that devoted.
Okay.
And I actually have a scar right here, so I am going over my scar.
I have such, like, you know, ropes in my neck that, how do I,
So just stretch it out a little bit,
oh, I see, okay.
and then
Got it, yeah.
how does the neck feel to you? Sensitive?
Fine, not bad. And you also do your chest?
I also do my chest, but we'll do that off camera.
Yes.
Because we don't need this video to be forever long. But I have people ask me to show how I do the neck, so that's why I wanted to show it.
And is the chest,
Sensitive?
yeah.
To me, not at all, strangely
Okay.
enough, even though there's nothing there either but bone. But to me, the chest is not sensitive at all.
Okay.
The neck is not bad, right?
Not bad. No, not at all.
You are doing so good.
Okay, good.
Good job.
I am definitely keeping up on that. That is really not as bad as I thought it was going to be. It's easy.
So I am going to wash my face because I have some pinpoint bleeding. You don't really need to unless you want to. You have a tiny bit on your chin, but so let me wash that off and I'll be right back.
Okay.
So Aftercare, we have some choices. We can just use high molecular weight hyaluronic acid, which will help with hydration. So this will definitely, your skin will feel a bit tight. So this will help with hydration. And also again, high molecular weight hyaluronic acid is anti-inflammatory. So we have that. My preference is growth factor serums. So these are approved post-procedure. Something else that we could use is things to be used for mesotherapy. And that's growth factors, that's peptides, all kinds of stuff, which are sterile because they can be, they are used for injection. But since they are sterile and used for injection, they obviously can't travel deeper into the skin. So something like that can be used, and that can also help enhance the collagen production. I don't have anything like that here right now, but that is something you could also use.
So these are growth factors.
These are growth factors.
Actually, there are sunscreens that are approved for post-procedure.
Exactly, like the Downtime D.
Yeah.
I still wouldn't want to put that on right now.
No, but like for the
tomorrow,
next day.
exactly.
That's why we're doing it in the evening.
Exactly.
So we don't need to worry about sunscreen.
Yeah. So I like to do it in the evening for that reason. I don't have to worry about sunscreen. I don't have to worry about anything else. I don't have to worry about pollution hitting my face and possibly settling in.
We're staying indoors today. And we are going to be filming our day 1, day 2, day 3. So that'll be interesting.
Yeah. So people see what the downtime is.
All right.
That's it. Thank you for doing this.
Thank you.
Good job.
You made it feel very easy.
Good, I'm glad.
Okay, thank you.
She's a pro now. Okay, we'll see you tomorrow. So this is about 12 hours after. So it's the morning after. And you can see there's definitely a difference in downtime. So Tamara has just a tiny bit of a pinkness. You said you have a couple of spots.
Yeah, I have a little bit of a red spot there, a little bit there, but otherwise, really I wouldn't even consider this downtime.
Yeah.
But I only did
0.5.
0.5.
And you don't have reactive skin.
And I do not have reactive skin.
So I went 1 millimeter and I have somewhat reactive skin. So it's great to see the difference in downtime though, because even when I do 0.5 millimeters, I definitely get more downtime. I'm not quite as red as I am now, but definitely more red than Tamara.
My skin did feel a little sensitive as I was laying on my pillow last night. Not painful, but it was sort of like I was more aware of my skin, whereas usually you don't even think about it.
Yeah.
So I was sort of tentative and gentle with how I positioned myself as I was going to sleep.
Good. And as Aftercare, you just continue to use the stem factor last night?
Yeah.
Good. So Tamara just did the stem factor last night, the Calecim, and I just did the Neogenisis. And so this morning I washed my face with a very gentle cleanser. And then again, I used the Neogenisis. And that's all I have on right now. And then I'm going to use a moisturizer. I'm just going to use this one. This is a nice barrier repair moisturizer. And you can use that as well. And then both of us are going to use the Ultra MD. And this is for post-procedure skin. So this is a tinted mineral SPF. So it'll cover some of this redness up. You don't really need to cover much up. But so this is a great one to use afterwards.
Okay.
And then tonight, I'm going to use this again. Some moisturizer, and that's it. I did not do my red light. So normally I like to do red light after microneedling. And I was going to do it, but Tamara suggested not to. So you can really see the downtime because the red light definitely takes some of that redness away. So we'll come back tomorrow. Is there anything else you think about?
No, my skin feels really good.
Good. A little dry maybe?
Definitely a little dry. Putting the stem cell serum on does help. I did that probably twice last night. And even upon waking up this morning, just because it did feel dry when I woke up.
And that's normal. It's transepidermal water loss.
Yeah.
So that's normal. It will feel a bit uncomfortable and dry for a couple of days. So just slathering on things like that, or I didn't bring it in, but the high molecular weight hyaluronic acid is going to help.
So I'm excited to get some moisturizer, and I'm excited to put all these things on. That'll feel good.
Good. All right. We'll come back tomorrow. Okay, so it is day 2. And as you can see, Tamara is pretty much back to normal.
Definitely. It really feels back to normal.
You had very little downtime.
Yeah.
I look a little red right now because I just took a shower, but my skin is actually not that red anymore. My face at least isn't. I'm always red here. That's just sun damage. But my skin feels like sandpaper. It's
it
very rough.
does?
Yeah.
My skin feels totally normal.
It does, yeah. No, you can't feel it. Well, try it. You can't feel it much now because I already did my skincare.
Oh, I see.
But
that.
it is a bit rough. So I did the same skincare as yesterday morning. You haven't done yours yet?
I haven't done my skincare yet.
That's okay.
It's sort of early in the morning for me.
But you're still going to keep it simple today?
Yes.
Yeah.
I'm not going to do any vitamin C. I will just do a basic cleanse, moisturize, and of course sunscreen.
Yeah.
The neck feels just a little bit sensitive. Otherwise, I feel completely back to normal.
So this is the Downtime with 0.5
0.5.
with somebody who doesn't have reactive skin.
Right.
Personally, with 0.5, I get more red than you.
Okay.
But I just have more reactive skin.
Okay.
And this is the Downtime with 1 millimeter here, and then 0.5 here, 0.75 here, 0.25 here.
So I am not going to let the Downtime hold me back anymore because this is nothing, at least for me.
Good.
Yeah,
Good.
I'm excited.
So I hope this was helpful.
Me too, and I'm excited to be doing this once a month. I know Claudia is going to be reminding me.
I'm going to text you. And in between, you go into Cosmetic Needle?
Yes.
Good. Yeah, me too. So thank you so much for being here. Any questions or comments, leave them down below. And that's it. Bye.
Bye. You're a physician.
We can't think of the correct anatomical term right now. That's okay. A nose and a PA right here. We can't think of it.
On the bone.
And it is a nice self-care thing, poking needles into your
Yeah, all right.
We keep taking sneezing breaks.
And then it doesn't happen.
And then it doesn't happen, which is so disappointing. Gross.
Okay.
Booger free? Okay. Okay.